What if one little pill you or a loved one takes every day was quietly shrinking the brain, not over decades, but in just a few months? Millions of seniors trust medications for allergies, sleep, anxiety, and blood pressure. Yet recent studies reveal a startling truth. Some of these prescriptions may be triggering memory loss, confusion, and even early dementia long before anyone notices. In fact, a new review found that 9 commonly used drug classes raise dementia risk by up to 80%. These aren't fringe treatments, they're mainstream, often prescribed without warning. From opioids to anticholinergics, each one can silently erode cognitive health, leaving seniors feeling lost in their own homes. Today, we narrow in on 6 drug categories you should know about: muscle relaxants, first-generation antihistamines, sleep medications, statins, antipsychotics, and tricyclic antidepressants. We'll share real-life stories, explain how each impacts your brain, and give you practical questions to ask your doctor. Number 1. Muscle relaxants. Muscle relaxants like cyclobenzaprine, Flexeril, and baclofen are often prescribed for pain or spasms. But in older adults, they can sedate the central nervous system, dull mental alertness, and disrupt memory circuits. A 2020 study linked long-term use to a 36% higher dementia risk. Over time, consistent use slows brain activity and chips away at cognitive health, often without any obvious warning signs. Take someone like Ivan, a 73-year-old retired librarian who began taking cyclobenzaprine for chronic neck pain. Soon, her family noticed her pouring milk into a shoe and confusing rooms. At first, they joked about her brain fog, but when these lapses increased, she saw a specialist and learned the medication was clouding her mind. Actionable advice: if you or a loved one use muscle relaxants regularly, talk to your doctor about alternatives. Gentle stretching exercises, heat therapy, and nonsteroidal anti-inflammatories and SAIDs can ease pain with less cognitive impact. Always ask if a lower dose or shorter course might work, and monitor any new memory or alertness changes closely. Number 2. First-generation antihistamines. First-generation antihistamines like diphenhydramine, Benadryl, chlorpheniramine, and doxylamine are often grabbed for allergies or sleep. But these drugs block acetylcholine, a neurotransmitter essential for memory and learning. Studies show long-term use can increase dementia risk by up to 54%, accelerating forgetfulness and confusion in seniors who take them nightly. Consider Franklin, a 71-year-old retiree who popped an over-the-counter allergy pill every evening. His son noticed Dad asking the same questions repeatedly and leaving items in odd places. Within 2 years, Franklin needed directions to his own church. Only then did his doctor connect the dots to his nightly antihistamine habit. Actionable advice: if you rely on antihistamines to sleep or manage allergies, explore alternatives like second-generation antihistamines cetirizine, loratadine, that don't cross into the brain. Better yet, try nasal rinses, humidifiers, or allergy-friendly bedding. Always read labels and check with your pharmacist to avoid acetylcholine-blocking meds. Number 3. Sleep medications. Prescription sleep aids like zolpidem/ambien, esopiclone lunesta, temazepam Restoral, and zaleploncenata are often prescribed for stubborn insomnia. What many don't realize is that these drugs disrupt the brain's natural deep sleep cycles, which are crucial for memory consolidation and cellular cleanup. Over time, interrupting this process can accelerate cognitive decline and raise dementia risk. Consider my friend Evelyn, 72, who started taking Ambien nightly after struggling to drift off. At first, it helped until her family noticed she was disoriented in the morning and mixing up names. She once used a spatula to comb her hair. After talking with her doctor and tapering off the sleep aid, Evelyn switched to a bedtime ritual of herbal tea, cool room tong, and gentle breathing exercises, and her morning fog lifted. If you rely on prescription sleep meds more than twice weekly, talk to your doctor about safer options. Simple changes: consistent sleep schedules, reducing screen time before bed, cognitive behavioral therapy for insomnia (CBTI), or natural supplements like low-dose melatonin can often restore restful sleep without compromising your long-term brain health. Number 4. Statins. Statins like atorvastatin Lipitor, simvastatin Zocor, and rosuvastatin Crestor are lifesavers for many battling high cholesterol. But in high doses, they can lower CoQ10, a nutrient critical for brain cell energy, and overly reduce cholesterol that helps maintain neural connections. Studies link long-term, high-dose statin use to a 50 to 60% increased risk of memory loss and confusion in older adults. Take my neighbor George, 74. After his heart scare, his doctor doubled his statin dose. Over months, he started forgetting familiar routes and mixing up names. He once poured orange juice over his cereal, convinced it was milk. When he mentioned it to his doctor, they adjusted his statin dose and added CoQ10. Within weeks, his memory lapses eased and his thinking felt clearer. If you or a loved one takes high-dose statins, ask your physician about checking CoQ10 levels or trying a lower-dose regimen. Lifestyle tweaks: heart-healthy diets, regular exercise, and plant-based supplements can sometimes allow for reduced statin doses without sacrificing cardiovascular protection. Always balance heart health with brain health by having an open conversation with your healthcare provider. Number 5. Antipsychotics. Antipsychotics such as risperidone Risperdal, quetiapine Seroquel, and haloperidol Haldol are often prescribed to calm agitation or hallucinations in seniors. Yet these drugs block dopamine pathways vital for learning and judgment. A 2023 review found long-term use linked to accelerated brain volume loss in memory centers, increasing dementia risk more rapidly than almost any other medication class. Take someone like Leonard, 72. He was given quetiapine after bouts of late-night restlessness. Soon, his daughter noticed he was pouring maple syrup into his morning coffee and trying to unlock the TV with his car key. Within 2 years, Leonard received a dementia diagnosis. His psychiatrist switched him to non-drug intervention structured routines, music therapy, and his clarity improved. If you or a loved one is on an antipsychotic, ask the doctor about non-pharmacological approaches first, environmental cues, cognitive stimulation, or talking therapies. If medication is unavoidable, explore the lowest effective dose and regular reassessment. Early planning and open dialogue can help minimize risks while still addressing challenging behaviors safely. Number 6. Tricyclic antidepressants. Tricyclic antidepressants like amitriptyline Elavil, imipramine Tafranil, and nortriptyline Pamlar are still used for depression, nerve pain, and insomnia, but they block acetylcholine, the memory neurotransmitter. Multiple studies link long-term use to a substantially higher dementia risk, with some reporting a 40 to 50% increase in cognitive decline among seniors on these drugs. Consider Delia, 75, prescribed amitriptyline for her neuropathy. Initially, it eased the pain, but soon she was pouring laundry soap into her coffee and asked her neighbor why her garden gnome was talking to her. Her family realized the TCA was causing severe brain fog. After tapering off under medical supervision and switching to an SNRI, her confusion subsided and her mood lifted safely. We've covered 6 medication classes that can quietly accelerate cognitive decline in seniors: muscle relaxants, first-gen antihistamines, prescription sleep aids, statins in high doses, antipsychotics, and tricyclic antidepressants. Each impacts critical brain pathways: acetylcholine, dopamine, sleep architecture, or nutrient levels, raising dementia risk if used long-term. Your key takeaway: never assume a prescription is risk-free. Review every daily medication with your doctor or pharmacist, especially if you're over 60. Ask about safer alternatives, dose reductions, or non-drug strategies. Early conversations can prevent irreversible brain changes before they start, keeping your mind sharp and your independence intact. Which drug class surprised you most? Comment below. Your insight could help someone else reconsider a familiar prescription. If you found this eye-opening, please like, share this video with friends and family, and subscribe for more expert health alerts. Hit the bell so you're notified the moment new brain protective tips go live. Thank you for watching and for taking action to safeguard your mind. Remember, your brain deserves as much care as your heart. By staying informed and proactive, you can enjoy every tomorrow with clarity, confidence, and the freedom to live life on your own terms. Take care, and I'll see you in the next video.